Ordinarily, for your muscles to move, which could be lifting your hand, closing your eyes, or even smiling, there needs to be a clear communication between the nerves and the muscles. But when this communication breaks down, you may develop what is known as myasthenia gravis. My name is Dr. Mercy Korir, and on this episode of Health Digest, Gloria Milimu brings you the stories of two people who've been affected by this condition, and later on sits down with an expert neurologist to explain this condition and whether or not there's a cure.
It is a rare, often unpredictable autoimmune disease.
It's a set of disorders that cause dysfunction at the junction of the nerve and the muscle.
We focus on myasthenia gravis, an autoimmune disease characterized by weakness and rapid fatigue of muscles under voluntary control.
I was hanging out with friends, so the eyes, especially this is usually my eye that tells me something is wrong. So it started shutting out down by itself. So you're trying to open your eyes, but it just shuts itself.
An unexplained sudden fatigue and a drooping eyelid were the first symptoms that marked the onset of a lifelong condition that 36-year-old Donald Kimutai from Nairobi's Balozi estate has lived with since 2016. The events of that fateful afternoon remains vivid in his mind, and how he would later make endless trips to the hospital in search of a diagnosis.
After the eyes, after the voice, then came the chewing. So you can't chew solid food for long. Things like meat, beef, chicken, they were too... You are getting tired, so... and then it was frustrating. So you don't understand what's going on first, and then you can't eat what you want. So you just learn to live with it. So I eliminated all the difficult things to chew from my diet. So basically the meats went, the boiled maize went, ugali had to be soft, not the hard one. So you basically buy the supermarket flour. You couldn't chew, so you chew. When you're eating, you take breaks in your meal. So you end up eating a meal that you can take 10 minutes. You end up eating for like 30 minutes or 40 minutes because you eat taking breaks so that the muscles can recover and then you can continue chewing. One day you're okay, the next minute you're not okay. So I remember things like washing yourself, bathing, combing your hair, spreading your bed. Things that you used to do normally, is just start being like a burden.
As days went by, nobody could figure out how Kimutai went from being an energetic person who was so full of life to barely being able to even wake up.
So at that particular point, I was just upset that by myself, because you visit so many doctors, you call in sick so many times, and then the issue is every test that is done to you comes, everything is okay, but deep down you're not okay. So that kept pushing me to find out what's wrong with me, because I wasn't imagining it. Your body is shutting down. You feel it every day. Every day is a new challenge. So if it's not the legs moving this day,
When one kidneys fail, they have one of two options, either to undergo routine dialysis or a kidney transplant, which is a more permanent solution to the problem. When it comes to dialysis, there are two options, either hemodialysis, where one is hooked up to a machine like this, sometimes 3 to 5 times in a week. But there's also peritoneal dialysis, which experts say can even be done at home. Elias Gulu sits in his hospital bed at the Kenyatta National Hospital, waiting pensively for the next dialysis session to begin.
Upande wa mkojo alikuwa na shida na alikuwa na hema, alikuwa hali yake sio mzuri, alikuwa hali mbaya.
Unlike in the past, when he would require a nurse to connect him to a dialysis machine that would remove waste and extra fluid from his blood, today, 14-year-old Elias from Kilifi County will be undergoing a much simpler yet effective process that his parents say has given him a new lease of life. Before being put on peritoneal dialysis, which is a machine-free type of dialysis, his parents, Joseph Galgalo and Agnes Zawadi, say that they had explored all forms of treatment for their son.
Alianza kupata shida akiwa na miaka 6. Alianza na spoti hapo chini ya mguu yake, spoti ambayo iko kama black, kama ambaye amechomeka na kala moto. Na sasa ile kukawa kuna black stuff ambayo imeaccumulate ndani, ambayo ni kama makaa ambayo imepondwa. It's black. Sasa tukakata ile sehemu na tukatoa ile unga ya makaa ndani. Na hapo ndio akaanza shida ya mguu. Kidonda ilikuwa kwa mguu wake, na tukajaribu kumpeleka kwa zahanati, hizi dispensaries zetu. Hapo Chamari kuna dispensary nyingine hapa Marafa kuna health center. Tukampeleka pale, akaendelea kutibiwa. Tukaendelea kumuosha na asali na kidonda ikawa kidogo inapona. Lakini kabla hiyo akaanza kufura mwili. Kabla hiyo kidonda haijapona, ilikuwa imefika karibu na kupona. Akaanza kufura mwili na tukaona tumrudishe tena huko kwa hospitali ya Malindi Sub County Hospital, na akaenda akalazwa. Alilazwa for about 8 days hivi. Na madaktari wakatuambia huyu sasa figo zake zimefeli. Sasa baada ya figo kufeli, hakuna option nyingine isipokuwa aanzishiwe dialysis.
Following the revelation of his son's condition after what started as a foot infection, Galgalo says Elias began undergoing hemodialysis in 2017. And that fateful day 4 years ago marked the beginning of hospital tours that would take them to all corners of the country and across the border as they sought answers to their son's suffering.
Kawekewa catheter kwa shingo na ikafanya tu muda mfupi, ikafeli, ikakataa kufanya kazi. Akatolewa, akawekwa kwa upande mwingine tena, na akaendelea nayo kidogo, hiyo pia nayo ikafeli. Ilipokuwa imefeli sasa, ndio wakatafuta sehemu ya paja na wakapata, wakamwekea mara moja. Na akaendelea na hiyo. Baada ya muda hiyo pia nayo ikakataa. Daktari akasema kwamba zile mshipa yake ime collapse, haina nafasi ya kupitisha ile mpira wa catheter. Kwa sababu hiyo sasa tukakuwa referred kwenda Makadara, Mombasa Coast General. Wakatafuta mshipa ingine, akapata, na hiyo ilifanya kazi muda mfupi zaidi na ikafeli. Ilipokuwa sasa hiyo imefeli, ikawa hakuna option nyingine isipokuwa sasa ni watu refer. Na hawakutuambia tuje Kenyatta, lakini baada ya kwamba wametu discharge pale, tukarudi nyumbani. Baada ya kurudi nyumbani, tukaenda tukakaa kama siku 4, na hali ya kijana ilikuwa inaendelea kuwa mbaya. Tukaona kwamba kuna Wakenya wengi ambao huwa wanaenda huko Tanzania, huko Moshi. Kuna hospitali nyingine kule Moshi ambayo inaitwa Kilimanjaro Medical Center. Na wanasema kwamba wanasafishwa figo na watu wanapona. Ndio sasa tukaenda huko. Ingawaje safari yetu haikuwa rahisi kwa sababu ya hii mambo ya COVID-19. Tulipokuwa tumefika huko, akawa admitted 5 days. Na wakajaribu sana wale madaktari wa hapo. Wakajaribu, lakini mwisho wakatuambia kwamba sasa sisi hatuwezi kumfanyia jambo lolote lile, isipokuwa sasa ni catheter iende ifanywe operation, mshipa ioperatiwe na ifixiwe hiyo catheter, na hiyo iko expensive sana.
Whereas hemodialysis remains the most common method of treatment, little is known about another type of dialysis that doctors say is just as effective yet more convenient for the patient. This method, peritoneal dialysis, uses the patient's peritoneum, a membrane lining the abdomen, to help filter the blood using a special type of liquid. What's more, it can easily be done from the comfort of one's home. Dr. John Ngigi, a consultant nephrologist and head of the renal unit at the Kenyatta National Hospital, explains how peritoneal dialysis works.
Peritoneal dialysis is a very good method of dialysis, just like hemodialysis that you're seeing behind me. Peritoneal dialysis simply uses the body physiology. It uses the peritoneal membrane, which is a lining inside the abdomen. And this lining is very vast, almost the size of the skin, with special holes. And if you put in some fluid there, then you can be able to get some exchange. That is, some chemicals can move from one side of the membrane to the other. So basically we use that membrane to do peritoneal dialysis. And as you have seen, we put in water, special fluid, and in that special fluid are chemicals which the body does not have, so that those chemicals go to the body, and the toxins or the poisons, if you like, that the body has because of kidney failure would come to the water, and then after some time you pour the water out. That is basically what we call peritoneal dialysis. And those exchanges or putting in the water inside happens 4 times a day. So a patient then will use those special bags with fluids, 4 of them per day. And every time the patient is on, then dialysis is happening. So it's a more physiological way of offering dialysis than hemodialysis. In fact, it's a better method of dialysis than the one you're seeing me behind, because it's more physiological. And also, if you like, it cleans or clears poisons or what we call the solutes more than this one behind. So patients are better off, their well-being is more reassured, and because you don't have to be in the hospital, because you can do this dialysis at home, then your economic life is much better.
Just days after their son was wheeled into the Kenyatta National Hospital, Galgalo and his wife, who has now received training on how to attend to her son without clinical aid, say they have noted significant improvements.
Hii ni ya kuwekwa maji kwa tumbo. Unamwekea maji kwa tumbo lita 1. Unamwachia masaa 4. Unamtoa, unamwekea nyingine lita 1. Tena unamwachia tena masaa 4. Wanachukua ikiwa lita 2. Naiweka hapa. Naiweka hapa. Naangalia kama ni lita 2 kweli. Kwanza nimeangalia kama imespy au iko sawa au siku zake zimeisha. Nikijua siku zake bado hazijaisha, ndio naweka hapa na pima nipate ni lita 2. Ndio nianze kumfungulia sasa. Niangalia mpaka ikifika kwa lita 1 ninafunga hapo. Ako naye nimemfungia hapo. Kuna pahali nafungia. Nifunge ndio nimfungue. Nimwachie masaa 4. Akimaliza masaa 4 nirudi tena. Nichukue tena ni connect hapa. Nifungulie maji ile ambayo nimemwekea itoke. Ikimalizika kutoka huku nikiangalia saa, lakini imetoka na dakika ngapi. Nikiangalia huko nikiandika. Nikirudi tena nimwekee niangalie imeingia na dakika ngapi. So nikimaliza nitajua nimetumia dakika ngapi.
When the patients come to us, we have to teach them what peritoneal dialysis is, the gadgets that we use for peritoneal dialysis, the importance of observing things like aseptic technique, and basically on how to note when they have contaminated the procedure. So cleanliness is very vital. They must observe high levels of cleanliness, from simple things like sweeping the floor, making sure that the places are dusted, and then they have the proper tables that we use for peritoneal dialysis, so that by the end of the day they don't have a loophole for infection.
In the event of an infection, patients exhibit symptoms like acute pain in the abdomen, bloating or a feeling of fullness in the abdomen, nausea, vomiting, fever, among others. Nurse Ambinja advises that patients should contact their healthcare provider in the event that they experience such symptoms.
This is a very effective method of dialysis. People may prefer hemodialysis because they think that it is cheaper. But if you imagine that this patient like now has come from Kilifi, he has his mother and his father here. If he was coming for hemodialysis, the father and the mother would be traveling from Kilifi to this place every 2 times in a week. But when we train them to do peritoneal dialysis, they go home with the skills which we have disseminated unto them. And so long as the peritoneal dialysis is working well, we can have, the patients can just be contacting us by the phone or even coming for their clinic, for their clinics, which may be once in 6 months or even maybe once in a year. Like for example, I have a patient who is on peritoneal dialysis that we trained rates in the year 2019. And he has never come to us. He just comes to correct his friends, and then the relatives goes back. The patient is okay, and he's all the way in Kitui. He came in very sick, but right now he's very well. He can even drive his tractors and do all the work that he could not do, and he's a retired old man.
Alipoanzishwa hii, niliona manufaa yake kwa sababu alirudi sawa. Si vile alikuwa akitengenezwa na machine. Sasa amekuwa amepona, yani kama amepona. Anaendelea vizuri, kula anakula. Alikuwa hali, kula anakula vizuri. Anatoka hapa, anaenda kuoga mwenyewe. Anarudi.
Dr. Ngigi says that a majority of patients on this procedure are children. In a week, the hospital gets 2 to 3 patients in need of peritoneal dialysis.
Because one, hemodialysis is more marketed. It's easier to provide, and is the one that you have known for a long time. But in other countries, say like for example South Africa and Europe, people prefer peritoneal dialysis first than hemodialysis. In fact, there's what we call peritoneal dialysis first, where people, before they go to hemodialysis, use peritoneal dialysis because it preserves kidney function better. For those people whose kidneys have not filled completely, it preserves it better. And like I said before, your well-being is more reassured when you are using peritoneal dialysis than hemodialysis. But again, it's because we have grown up knowing hemodialysis than peritoneal dialysis. But also, peritoneal dialysis is a bit expensive. It's expensive because in the short run, people have to use this fluid which we are talking about, and it's expensive. But in the long run, it's perhaps even better economically than this one, because people who are using this one are able to run their normal life better, and they're able to be economically active.
Changamoto yetu kubwa ni maji. Ile maji ambayo inatumiwa kufanyiwa peritoneal dialysis hiyo ya PD ni ghali sana. Pakiti moja ni 3,300. So hiyo hatuwezi kuafford kununua hiyo, maana kwa siku anatumia 2.5, ambayo sasa ni almost 10,000. Na yeye anatakikana atumie continuously. Baada ya masaa 4 lazima atolewe maji na awekwe ingine. Kwa hivyo it is a lot of money.
The government, through the National Hospital Insurance Fund, NHIF, has a renal dialysis and kidney transplant package that includes coverage of dialysis of up to 2 sessions a week at 9,500 shillings. The kidney transplant package covers up to 500,000 shillings for both donor and recipient. However, peritoneal dialysis that costs a patient like Elias an average of 300,000 shillings per month is not covered, and doctors say this disparity exposes gaps in the management of renal care in the country.
Peritoneal dialysis, you are at home. So in the long run, the economics of peritoneal dialysis are favorable than those ones of hemodialysis. In any case, when patients do get transplants, because you can transition through to transplantation through hemodialysis, peritoneal dialysis, they are better off. People who do transplantation from peritoneal dialysis are much better off than those ones who do transplantation from peritoneal dialysis, from hemodialysis. Also, the blood pressure control, water management, and anemia management is much better when you are on peritoneal dialysis than on hemodialysis. So we have got so many reasons to want to talk about peritoneal dialysis than hemodialysis.
Those eligible for peritoneal dialysis include
people who may require peritoneal dialysis are limited. But one, children, because of their size and because you cannot get blood vessels, are likely to be on peritoneal dialysis than on hemodialysis. So it's the preferred choice of dialysis for children and those people who are small, so to say, not necessarily children, even some small adults, particularly those people whose blood vessels are not very well formed. Another group of people who can benefit from peritoneal dialysis are those people like the elderly people whose blood pressure is not good. Like, for example, people whose blood pressure is very low are likely to benefit from peritoneal dialysis because, as you realize, the hemodialysis is very harsh to blood pressure. But peritoneal dialysis is slow and gentle because it doesn't cause blood pressure shifts. So for those patients, even patients in ICU whose blood pressures are low, they are likely to benefit from peritoneal dialysis. So it's a preferable method.
This simple yet effective method of managing kidney failure is still an alien proposal to Kenyans. This procedure, which has been proven to be better and more convenient to the patient, is still uncommon in Kenyan hospitals and homes. Located on each side of the spine and the lowest part of the rib cage, kidneys play an important role in the body, with the primary function of the bean-shaped organ being filtering waste products, excess water and impurities from the blood. When this function is disrupted, one loses the ability to sufficiently filter waste from blood. Patients are left with two options: dialysis to help the body remove waste, or a transplant to restore normal functions.
When Arias was coming to us, he was completely cachexic. He could not eat well. He was vomiting whatever he eats. But no sooner after doing dialysis, he starts eating up everything, even what we had forbidden him to eat when he was on hemodialysis. So by the end of the day, you come to realize that when the patients are doing peritoneal dialysis, they are in good well-being, and they are themselves. It's like, so long as the fluid is in the peritoneal cavity, I tell them it's like you have a working kidney.
With two options for dialysis, patients in need can pick the option that suits them best. For Health Digest, I am Dr. Masi Korir.
This is KTN News.